Today we're going to talk about something you've probably seen before, but maybe just didn't know the name for it, Pterygium. We're going to break down everything you really need to know.
So, before we dive into all the medical jargon, let me ask you this. Ever heard of surfer's eye? It's a great nickname, right? And it actually gives us a massive clue about what causes this thing. Stick with me, and I promise it'll all click into place.
All right, so here's what we've got on tap today. We're going to cover what a pterygium is, what causes it, the signs and symptoms to look out for, how it's diagnosed, and of course, treatment and any potential complications. Let's get right into it. Okay, so let's jump right in. First things first, what is a pterygium anyway?
So, in simple terms, a pterygium is this growth of fleshy tissue. And don't worry, it's non-cancerous. It starts on the white part of your eye, that's called the conjunctiva, and it can kind of creep over the cornea, which is that clear window at the front of your eye. The name itself is pretty cool, actually. Pterygium comes from the Greek word for wing, because it often has this distinct wing-like shape.
So that's what it is. But the big question is, what causes this little wing-shaped thing to show up on your eye in the first place?
Aha! And this is where that surfer's eye nickname comes right back into play. The number one culprit? Long-term exposure to UV light. We're talking about the sun. That's why people who spend a ton of time outdoors, like surfers, fishermen, farmers, they're at a much higher risk. But it's not just the sun. Chronic dry eye and constant irritation from things like wind and dust also play a huge role. You can almost think of it as your eye trying to protect itself from all that environmental stress.
Okay, so you know what it is and what causes it, but how would you even know if you have one? What does it actually look and feel like? Let's get into the signs and symptoms.
Well, the thing about a pterygium is that what you experience can really change as it develops. When it's in the early stages, it might just be a minor annoyance, a little irritation, some redness, maybe that gritty feeling like there's sand in your eye. But if it keeps growing and starts to get more advanced, heading towards your pupil, that's when you'll notice a real difference. It can start to blur or distort your vision and become way more uncomfortable.
All right, let's say you're dealing with some of those symptoms and you're thinking, maybe this is what I have. How does an eye doctor actually confirm it? The good news is it's a really straightforward process.
Yeah, it usually just comes down to 3 pretty simple steps. First, your doctor's going to ask you about your history, your symptoms, your lifestyle, how much time you spend in the sun, that kind of thing. Second, they'll do a standard vision test with the eye chart, just to see if the growth is impacting how well you can see. And then, the final and most important step, the slit lamp exam. Now that sounds fancy, but it's really just a special microscope that gives the doctor a super magnified 3D look at your eye. That's how they can see it up close and say, yep, that's a pterygium.
Okay, so the diagnosis is in. Now what? What's the action plan? Well, the treatment really depends on how severe it is and, honestly, whether or not it's actually bothering you or affecting your life.
You know, for a lot of people, especially if it's a mild case, the game plan is pretty conservative. We're talking about managing the symptoms, not necessarily jumping straight to surgery. This could mean using lubricating eye drops or artificial tears to soothe that irritation and redness. And this part is absolutely crucial. Wearing good protective eyewear, sunglasses with 100% UV protection anytime you're outside. That can seriously help stop it from getting worse. After that, it's pretty much just a wait-and-see approach, just keeping an eye on it for any changes.
But what if it is causing big problems? If it's messing with your vision or it's just really uncomfortable all the time. Well, then surgery becomes the best option. And the procedure itself is very methodical. First, they'll numb your eye so you don't feel anything. Then the surgeon very carefully removes the growth. Now, here's a really key step. They often place a tiny piece of tissue, called a graft, over the area where the pterygium was. This little graft acts like a barrier, and it makes a huge difference in preventing it from growing back. And then after that, your post-op recovery begins.
All right, last section here. What's the road ahead look like? It's really important to know about any potential risks or complications, especially after treatment.
So, the biggest thing to watch out for is recurrence. That means the pterygium can sometimes grow back, especially if a graft wasn't used during the surgery. It's the most common concern. There are a few other less common risks, like some scarring on the cornea, maybe some persistent redness and irritation, or in pretty rare cases, some changes in your vision. And this is exactly why follow-up appointments and continuing to protect your eyes from the sun are so important.
And you know,